thanks for Implantswiss for inviting me to do this live webinar with you. So I am so happy that you are joining now, and we will just till 2 minutes till we are exactly 9 o'clock. Let's say my time and 7 o'clock your time, guys. So I'm so happy now to be with you and talk to you about Implantswiss. Implantswiss, this is an implant system I'm using since several years, and I am so happy with it. And I would like to share with you the system. You can see the benefits on it, what you can do with it, what are the clinical implementation, and then we will do hands-on together to show you step by step how to use this implant and share with you some of my surgical techniques and skills, so that will help you to improve your success rate, do implants more efficiency, and have a better aesthetic results. So Implantswiss, are the implants we are talking about, all right, that you have it in this design, and we will discuss now in details what you can see here. Of course, now the tradition is the bone level implants, and we have it as you can see here, and it is with hexagonal and internal or conical connection. Now the conical connection, it has proved that there will be no screw loosening, no rotation of the abutments, and distribution of forces is much better as you can see here. So this is the implant, this or the fixture, this is the abutment as you can see here, and this is the conical connection. That is the beauty of it. And if you realize this unique design of the implants, the macro design of the implants as you can see it here, it is tapered and straight at the same time to condense the bone. And so it is a hybrid design as you can see it here. Everything is all coming together in this form as you can see here. Everything is been studied very well in order to have this hybrid design. Of course, this is a very unique design. Not many implant systems they have it, but after a long research, you can see this combination of the hexagonal for anti-rotation and for the conical connection. This is the state of the art, and this is what Implantswiss are following it. Of course, with the conical connection, you can do something called the platform switching, and the platform switching proved that you will not have any micro leakage. You will get the bone away from the bacteria, and with platform switching, no doubt that the bone will remain at the crest of the implants without any problem. And with any histological studies, there is no doubt that you will achieve the healthy, the emergency profile, the healthy gum, and you avoid or reduce the risk of peri-implantitis. Of course, you need an implant with self-cutting edge, and this is very important in order to have the primary stability, all right? And at the same time, you don't need any sharp threads at the neck of the implants in order not to harm the cortical bone. And this is the problem that we have every time. When it comes to the microstructure of the implants, you can see this is special surface. It is sandblasted, rough, and acid-etched surface, which can increase the surface area a lot. So you will have a faster osseointegration and more stable long-term implants. And that's what is the bone loves, to have such design in it, as you can see here. So this, even at electronic microscope, you can see this SRA surface, that it is like after 20 years of research, most of implant companies, they like to stick to such surface because there is no doubt this is a surface that it is long lasting, osseointegration is perfect on it, and it is very clean surface I can see. So that is the surface treatment everywhere. Now, when it comes to bone level implants, as you can see here, you can have all the possibilities and all the diameters from 3.3 up to 5.5. All right. So you can place in a very thin bone, like the cases I will show you later, to the 3.7, 4.3, 5.5, and 4.8. You, with the bigger implants, you have a bigger platform and so on. At the same time, also for the people who love the tissue level implants, also Implantswiss, they have their full range, also from 3.7, 4.3, 4.8, and 5.5 with wide platform. And these for the posterior implants is amazing for the people who would like to have an open healing. So the option is there. Now, when it comes to the implant package, this is really a unique, prestigious, and good package, as you can see with the implants. The surgical kits, color-coded, all the drills are arranged with a stop, and each link has a drill, and this is very important. And at the same time, people now, they are looking for short implants. Yes, they have as short as 4 millimeter and 5 millimeter according to the diameter. So you can have 4 and 5 and 6 millimeter of implants. And they have really long-term success even with 4 millimeter of implants because of the special design and because of the special surface. So all the different lengths, diameter are available from Implantswiss. You can start from 3.3 as a diameter, go up to 5.5, and from the length you can start from 4, 5, 6, 8, 10, 12, 14. So you have a full range of implant sizes. And you can see here also, even with the polished surface, you can have down to 4 millimeter and with a diameter of 4.3. And it is mechanically tested that this implant with these sizes are really perfect to accommodate everything. We also made it life easy because the uses of short implants are really very limited. So we made a special kit for the short implants, and you can have the drills with the stopper for each length. Because when you are using a short implants, you are very close to the nerve or you are very close to the sinus. You don't want to injure the nerve. You don't want to go into the sinus. So you need any individual right drill with a stopper. So there will be no risk, especially for beginners. And even with people who are also with experience. If you are doing implants so fast, right? And if we are getting old and with our vision, you need really an implants with a stopper. And that's what I love with Implantswiss, because I've been using several implant systems, but once you have an implant or a drill with a stopper, that makes your life easy and you work with confidence, because many times with the blood, we cannot really see exactly, where are the, the measurements. So once you have the drill that it is have a stop, that makes your life easy. So that's all about the implants and the surgery. I'm sorry that I am going so fast, but because I have a lot of things to show to you tonight. So when it comes to the prosthetic, of course, you have everything from titanium also as well, from the cover screw to the gingival formers, to the transfer, to the implant analog, to the different abutments. And you can imagine the beauty of the platform switching and the internal hex. So to summarize to you and to let you familiar with the system, so the Implantswiss, they have bone level implants, they have tissue level implants. From the bone level implants, we have the mini platform and the regular platform with the diameters from 3.3 up to 5.5. The regular platform, it starts from 3.7 up to 4.8. The tissue level, the same thing, it has the standard from 3.7 up to 4.8 and the wide 5.5. So you have everything. There is no limitation for the full inventory that you might need and can use. And the good thing, the compatibility of the prosthetic. So you have always one abutment that it can go to 3.7, 4.3, 4.8, 5.5 from the bone level, and they are with internal connection and they are compatible with Astra. Only one abutment can fit with all. So even if you have a shortage in stock, for example, from the 5.5 abutment, you still can have the 3.7 or 4.3, and you can use it on 5.5 implants because it is the same connection and the concept is the platform switching. So even if you are using a narrower abutment for bigger implant, you are okay. and that will reduce your inventory in the clinic. For the tissue level, it is compatible with the Straumann tissue level. So this is important when you work with the prosthetic, because usually the prosthetic is a big range and can make you confused. But with Implantswiss, because they are all fitting together, that makes life much easier. And of course, you have these healing abutments, which can give you a perfect emergency profile and tissues around the neck of the implants, so you can build up the nice prosthetics later on. And that is what you can achieve with such implants. Look, imagine this beautiful shape of the mucosa because of these smooth, right, parts. Solid system, yes, it is a solid system, as you can see here. This is the implant, this is the abutment, and you have the special key for it. And at the same time, you can see all the varieties from the healing tab to everything. So it is available for all the diameters, as you can see here. But as I said earlier, they all fit each other. So with this solid system here, as you can see, one key for all the prosthetic parts. When it comes to the transfer, all right, it's an easy, simple plastic cover where you can do the transfer and you can finish, and your technician will have an easy life to do all of these points. The transfer is very clear, very easy. There will be no rotation at all in the impression, because we know that the problems we have with some transfers in some companies, that you might have a problem. And once with this system, with this solid system, you can fabricate, you have like ready burn out plastics to make a casting for the metal, or you can do it with the CAD CAM. You want to make a zircon crowns and whatsoever, and you can have a finished crown as good as this. So your technician is really very happy. For the people who would love the coupled system, that the transfer or the indirect impression techniques, yes, they give you all the parts. So you have a pickup, okay, impression post, as you can see here, a transfer. Always it is one key for all the prosthetic parts. So that makes your life easy. So you decide to make an impression with a coupled system or indirect, you just pick up the transfer, fix it on the implants, get the laboratory analog, and also it is the same analog for all the diameters from 3.7 up to the end. The only difference is the very narrow implants, the 3.3 is the only diameter that we have that you need a different abutment and analog and so on till the end. The rest, the 3.7, 4.3, 4.8, and 5.5, whatever you have a transfer, it will fit on it. The same lab analog and the same abutments can fit on all, and you will have only one key, which is the 1.2 hex. That makes life easier. So as you can see here as a summary, whether you are using a straight abutment or an angulated abutment, your technician can do everything in a simple stage. So all you need just to make an impression and give it to the technician, and that's it. Whether you are using also the tissue level or the bone level, all are available with all these parts. And this is the way, as you can see here, all you need to do is to mount your transfer on the implant, put your impression material, as you can see here, pick up your open tray, as simple as that, give it to the technician where he will put the implant analog, cast the cast, and he can have the idea about the soft tissues and everything. And no matter what, even if your implants are not parallel, all right, because of the conical connection, it doesn't matter. You can still pick up the impression, cast it, select the abutments, whether are straight or angulated. Your technician can modify on the parallelometer, and you can have it easily fit because it's accuracy 100%. So me personally, I would love always to work with the coupled system. It is reducing the clinical time, and of course, you save your time on the chair side. The technician will have more headache, but this is his part. you're not making your patient tired, then you can give your technician an impression and your job is finished. That's it. The technician will bring everything afterwards. So your job as a dentist, just only this simple step is to prepare your specialty tray, mark the transfers, mount them on the patient's mouth, get your specialty tray as you can see here, and pick up your impression, and that's it. Your time in the patient's mouth on the dental chair is limited, just taking the impression. The rest of the work is all going to be for the technician to select the abutments and do on the parallelometer all the necessary preparations. You can have also with the couple system a closed tray or an open tray according to your preference. Me personally, I love the open tray system, but if you prefer the closed tray system, it's both options are available because there will be anti-rotation, okay, marks where you can place the transfer in the impression, and easily, as you can see here, there is no chances for any error. Everything has only one place, one fixation. Of course, we have the Octa system for the people who would like to work with it. Yes, it is available. We have the complete range from the healing to the transfer to the impression, everything also in one system. So the Octa system is available for the colleagues who would like to work with it, same options. So the varieties are a lot. The varieties are a lot. The accuracy of the impression is there and all the tools. So when it comes to the prosthetic, I know I am a surgeon, I'm not a prosthodontist, but I do the prosthetic myself because I would like really to finish my case myself, and because I always do also backward planning. I know what's going to be the end result of my prosthetics before I place my implants. But whatever you are familiar with as a dentist or as a prosthodontist, you will have the options available. So this is also for the colleague who would like to work with the Octa system. Yes, it is available. Yes, it is as good as accurate as you can see here. And you can, of course, use a screw retained crowns, and you can have them as beautiful as you can see here. So the system is there. From the time of surgery, you can select what you want, and you are ready to do the transfer. As you can see here, these are the implants at the time of the surgery. With the Octa system, you're placing these abutments. These are the impressions if you want to make immediate loading, because with completely edentulous maxilla or mandible, yes, you can make immediate loading when you, okay, mount the implants together and you connect them together, as you can see here. And then the framework as ready, as you can see here, and you just screw retain them and just close with composite afterwards, and you can have the beauty of the options. So that is the really good about it. Look at even the parallelism. Even if you are not good with the parallelism, with the Octa system, yes, yeah, you can modify it. For the people who would love overdenture, yes, we have the O-ring system. It is complete. And even you can take an impression and give the whole work to the technician. The O-rings, as you can see it here, the retainer, whether you are using tissue level or you are using bone level, you have all the varieties. So you can imagine what is the size of the variety of the prosthetic that you have. And you have, of course, different powers from 350 to 500 to 900 grams. It depends on the age of the patients and how retentive he wants it. So with the O-ring system, you have all the options and the amount of stability. Of course, you have a special key for the fixation of it, where you can also, with the same ratchet, you can tighten it up, making the impression and do the whole work at the lab side. I really would love always to save my time and give the rest of the time to the technicians. Also, at the same time, we have the locator system. Yes, it is available for the colleagues that you can see. So from what I described to you, you can see there is no system in the world from prosthetic choices. It has some limitations. I've been working with many systems. Some systems, they say, oh, we don't have locator. No, we have only O-ring. We don't have multi-unit abutments. No, we have multi-unit abutments. We don't have straight abutments. We have angulated. What angulation do you have? What we are showing to you today, everything is available in one catalog from Implantswiss. Even the bar system. I'm not using the bar system anymore. All right. This is a history, but there are some colleagues, they believe in connecting the implants together to get more stable denture. Yes, it is there. So even the bar system is also available. So you can see we are covering all the different modalities from removable to fixed prosthesis over the implants. Yes, it is available. You want to make it castable, as you can see here with the full denture. Yes, it is there. You want to use the bar system. This is a classical one. It is still existing and it is in our line. But of course, now you can see all the fashion about the multi-unit abutments. Yes, now we have the multi-unit abutments in 0 angulation, in 17, and also in 30 degrees. So whatever your angulation of the abutments when you are doing all-in-4 system, yes, you can have it. And the multi-unit abutments here, they can make your life easy with the angulation that you want, and you can retain your prosthesis, and you can do it with the CAD/CAM system. If you need just a planning, yes, we have an abutment planning kit, so you can know what you need to use later on, all right, to make it easier for you for the selection. So it is really available, and that's why we really aim to reduce your inventory, because when it comes to the prosthetic, as you can see, we have everything. We have the full range, but I don't want people to get confused. I don't want the beginners to get confused. So they have everything that it is available. And this is really not easy to find this full complete range in one system. But Implantswiss, they have it because they are having a long history with manufacturing the implants, and they know the feedback of the doctors and always try to meet the doctor's expectations. That's why you can see all the line, and even from the tissue height, whatever you want, 1, 0 or 1 or 2 or 3 or 4 millimeter, they are all available. Now, the fashion for the digital, yes, we have a complete digital solutions. We have body scanner for the impression post, for the transfer, so everything can be digitalized. And now with all the CAD/CAM, they have also our data. If your CAD/CAM machine or your technician doesn't have our library, yes, we can give you the software and you can completely digitalize your prosthetic work. You don't need even impression materials. You can have your scanner, or you can take a classical impression at the same time. Then the technician can have the scan body and can finalize your work. So with Implantswiss, you have everything. And this is not only the classical implants, also the zygomatic implants. Yes, it is part of our range for the maxillofacial surgeons who are really wants to have the zygomatic implants. It is available, you can order it, and this is not too much for the general dentist to focus about, but it is there, it is existing, and you can use it and have it in part of your inventory. Of course, our facility is in Yverdon in Switzerland. I was there 2 years ago. Thanks for Implantswiss. They invited me to Switzerland and to visit the facility. It is really the state of the art, one of the best implant manufacturing facilities I have visited. I've been invited to visit many implant companies in the past 25 years. And when I visited their facility in France, I was really impressed. It is top of the art, and that's why they have this long experience, so they can give you every part that you want. So with Implantswiss, you all said it is one solution in from one place.
Yeah, definitely.
All right, so I think we are on time. So far,
Ang
the introduction, and I think we will leave the questions till the end. I just want to share with you, all right, 1 or 2 cases to show you what we can do with Implantswiss. Look at this case, Okay, a patient comes to you with a first visit. You look at the case, you have some broken teeth that are hopeless, they need to be gone. You see some spaces. And with implant dentistry, I want you guys always to plan the ideal situation. The patients, they don't need the shortest treatment time and the fastest time. They want the ideal aesthetics. They want to have everything as they want. So with a patient like this, we decided to extract all the hopeless teeth, make a prosthetic, an orthodontic treatment to organize the spaces, align the tilted teeth, and then the time needs to come to place implants. Of course, when you take a panoramic X-ray, as you can see here, you will have an idea. Yes, we have an enough height of bone everywhere. But what about the width? Do we have an enough width? The panoramic X-ray will not tell us. So after we take our cone beam CT and we start examining the different cuts where we want to have the implants, this is the reality. So this height that I needed, and the patients who needs an optimum aesthetics, and he needs not a long crowns, and he needs an ideal implants to be placed where he lost his teeth. So in this case, we examine, and this is the disaster, that we have a 2.8 millimeter. And you know, with the implant Swiss, we have the narrowest implant 3.3. So even 3.3, you cannot place in this ridge because you need at least 1 millimeter all around the implants. So height is excellent, but the bone is very thin. Look at the different sites where we want to place implants. Everywhere we have limited width of bone. Why? It is because it is after extraction and because of the orthodontic treatment. So we lost the width everywhere. Look at this cut. When you look at this case and you want to place implants, and this patient does not need any splinted teeth. He needs one implant per missing tooth. So he needs one implant here, one implant here, and he needs implants here to replace all the missing teeth. So here we need to place 2 premolars. And look to this shape of ridge. What can you do about it? Let's go to the mandible. Oh, we are very happy. We have very good amount of bone above the inferior alveolar nerve. But what about the width? Look, we have also here 3.3. All right, everywhere we have a problem with the width of the bone. And in such cases, and after the patients went through the orthodontic treatment and everything, you don't need really to go in another complicated surgical treatments to make a blocky graft to get a wider ridge. So what is the solution in such case? So let's see what we have done for these patients. The upper jaw, we decided after the CT scan to do something called bone splitting. And I just want to show you, with bone splitting, you need the armamentarium, you need the piezo surgery, you need the special wedges where you can split the bone. Look how thin is this ridge. And we were able to split it. All right, maybe the time doesn't allow us to go now into details, how we do the bone splitting, but I will try to share with you now step by step how we do it. So we use our piezo, we use our chisels to split the bone. You need to be very careful and take your time, but really you will get one surgery that you are splitting the ridge completely. You are preparing with the special drills of the Implantswiss, the osteotomy for your implants. You are preserving the cortical bone, and you can see you placing the implants here. So look at this beauty, and that's what I want. I need a special design of the implant. I need the implant to have an excellent primary stability in a splitted ridge. All right. And I need also a conical connection later to preserve all my bone. And I need an implant to have an excellent primary stability from the macro design and from the micro design also to replace the teeth as soon as possible. So these are the 3 Implantswiss implants are replaced. This is the classical platform. all right, because I cannot use a wide platform, of course, here. And the implants are here, and they are like a sandwich in this splitted bone. Can you imagine? Afterward, you put the healing abutment or the cover screw, whatever you want to name it. Excellent primary stability due to the special design. And then you can augment the gap. Or believe me, in some cases, I don't even augment, because when you have a gap closed, full of blood, the blood will turn into bone. But we as a dentist, we love to fill every cavity. So if you want to use some bone substitute, it does not harm. You can place a membrane on the top of that, all right? Because you will not have enough tissues to cover everything, because the ridge now, we change it from 2.8 or 3 millimeter. Now it is 5 or 6 millimeter in width. You suture, as you can see here. And let's move to the other side. Imagine in a very thin bone like, all right, you also can still make your bone splitting, as you can see here. You can also place the Implantswiss here. You still have the cortical bone around it. This is one surgery. I did not use any blocky graft. I just used the bone splitting technique. I placed my implants everywhere as I wanted. And this is the post-operative X-ray for the maxilla. So one implant is here, one implant is here, 3 implants here, replacing the 4, 5, and 6. Every implant will replace one tooth. The bone is very thin, and we were able to place 3.3 and 3.7 millimeter in diameter implants, and they are look as good as you see here. Still, we have, of course, have the orthodontic to preserve the space. The same thing with the lower jaw. You can imagine, this is the reality. This is what the cone beam CT showed us. We open the flap, we see the thin bone, and we start also the bone splitting technique. We use our chisels in order not to lose any bone. Because if you start drilling, all right, all the bone will be gone, but you have to split it. And these are the special wedges that we are using to split the bone. Even if you have green stick fracture, don't worry about it, because it will be repaired during the healing time. And this is our osteotomy, as you can see here. And these are also the Implantswiss implants are placed here. And I can augment all these gaps, don't worry about it. So these implants are here. Excellent primary stability, that's what I want. Very thin bone. I can augment, as you can see here. I put my membrane and I close. The other side, same thing. By the way, really, this patient was unlucky in every single gap. In every place I want to place my implants, I had thin bone. But the same treatment plan, one surgery, open a flap, make my crystal incision, make the splitting, use my wedges, as you can see here, prepare for my osteotomy, place the implants, excellent primary stability, platform switching, conical connection, clean implants, put your healing cap, and enjoy the beauty of the post-operative panoramic X-ray. So 4 implants in the mandible, 5 implants in the maxilla, all are in, okay, we did 2 separate surgeries because upon the patient's request, but it was one-time surgery. Open a flap, split the bone, place the implants, get a secure primary stability. You are confident with the implants that these implants, they have a very special surface. So they will osseointegrate because you secure the primary stability. Because always remember, this is a general rule in implant dentistry. If you don't have a primary stability, your chances for osseointegration is almost obsolete. And this is the case completed. As you can see here, the patients have beautiful emergency profile, nice abutments, nice gum, nice papilla everywhere. All the teeth are there. The case is completed with one surgery. We did not need to make any blocky grafts, nothing, with an excellent implants, with platform switching, and the patients can have such. So that is really the beauty when you have an implant system that you can use it in the extreme difficulties of bone situations. I don't want to show you classical cases with normal bone of height and width. It's just you can place maybe any implants, but I need an implant system that it can support me to play with it. Whatever I want, I can do. Let me share with you also another case. All right. I'm supposed to finish the theoretical part in 30 minutes. We are already like 35 minutes, but I could see if you are interested, I will share with you now another case, but I will go faster. But I want to show you what you can have really with Implantswiss. Look here at this case. The cone beam CT showed me it's opposite the other case. I don't have height here. I don't have height here at all. So what is the options I have? I need to do nerve transpositioning, which is my favorite technique. I can talk to you in a separate lecture about nerve transpositioning, or you can see it on our Facebook pages. We already have some lectures there, and you can see it and view it. But we want to make it in a different way. But we need reliable implants that can help us. So look what we have such case. All right, we already did several implants, Swiss implants in this case, and we completed, but we left this side, okay, because we know that we don't have enough bone above the nerve. And to be honest, I am not really very friendly with the very short implants, okay? They are existing, but if I can use a regular implants is better. No doubt, 8mm implant is better than 6mm and better than 4mm because of the crown implant ratio, the mechanical stability, and so on, and the risk of peri-implantitis. Because if a patient will lose 1 or 2mm of bone on a 4mm implants, of course, the implant will be gone. So this is a case, but I decided also to develop and to use different techniques. I really like to do different techniques because at the same time also, when we have our master students and our IBOI students, the International Board of Oral Implantology, they love to do different cases. So these cases, we bring it, these patients are volunteers, they have the surgery free of charge, and the students can try different techniques. So I remember with this case, we said we will use the ring blocky grafts. We decided to extract the hopeless teeth, to clean, to flatten the ridge, and then go to the ramus. And we want to harvest 2 ring blocks and do 1 surgery. We don't want to make vertical augmentation with the blocks from the ramus or from the symphysis, fix it for 3 months, then come back again and make implants. So we know that we can do it 1 stage, but we need an implant with a good surface, with a good threads that it can hold my ring blocks. So we prepared with the drills, all right, according to the diameter of the implants inside the ring before we remove it. And after we prepared our osteotomy for the implants, we decided to remove the blocks and harvest it, as you can see here. These blocks, we fix it with the implants, but we have to prepare a bed for it. We need to create a bed. We remove the cortical bone because of the blood supply. We needed to integrate together. So these are our 2 rings. We use them as a surgical guide, as you can see here. We prepare for our implants and we fix the blocks or the rings with the implant. And that is the beauty of the Implantswiss, as you can see here. The ring block is fixed with an excellent primary stability. The bed is prepared, and you can finish this in 1 surgery. So these are the 2 rings. These are the 2 implants. And in this case, we used 8mm implants. This is the mental foramen that we know that we are protecting it. And this is the way for the donor side and the recipient side. And this is the case completed and sutured. And this is the X-ray afterwards. And this is with the prosthesis. And these are all Implantswiss cases. I show you quickly the last case for tonight. This is also a case for one of my students. He wants to do all in four. We said fine. We did a clearance. Patients came to us. We were examining with the cone beam CT, and also we realized we have a knife edge ridge. All right. In this case, because it is all in four case and it's completely edentulous, somebody will tell me, yes, why not? We can shave the bone here. We make a cristotomy and we remove all this thin bone and we can place our implants from here, right? You can place the implants from here. But why to do it? This is the ridge. You open a flap, you can see it as thin as here. So one classical option is to shave the bone. And the second thing is, no, I want to preserve the bone and I want to make a complete bone splitting. I love really bone splitting. It's easy, simple, because the bone is elastic. You can really split it the way you want. This is my planning for the all-in-4. I expose my mental foramens. I can see very good the flap. I can make my marking. These are my wedges. These are my paralleling posts. These are the drilling guides. And once everything is splitted, as you can see here, I start placing my Implantswiss implants, as you can see it here. So the implants there, these are the first two implants, the straight one, then the angulated ones. And this is what I want you to see. In a splitted ridge with the special design of the implants, you can have up to 35 Newton centimeter with the primary stability. With any other design implants, you will never get this stability. And that is the sharp threads. And that's what I love about Implantswiss. So you can see here, 4 implants are placed based on the all-in-4. And when it comes to the prosthesis, all right, I finished the case as you can see here. It's beautiful. You can have all the options. Multi-unit abutments, yes, you have 30 degrees, you have the 0 degrees, and you can complete the case. And these are the 4 implants as you can see here. I'm sorry, I will not show you the prosthetic photos. They are with my prosthodontist. He did not share it with me to this lecture. So I think by sticking to the time, because we appreciate your evening and your time after a long day of work, and we come to this point that we finished the theoretical part, showing you the system, all the parts and the uses of this system, and I only selected for you some special difficult cases. Of course, with the easy cases, it's a straightforward and you would love the system. But I wanted to show you, even with difficult situations where only limited implant system can be used, you still can use Implantswiss, because you need the primary stability, you need the different lengths, you need the different diameters, you need the platform switching, you need a good special surface for faster osseointegration and for long-term osseointegration. You can have it all in one system. All right. So Ibtisam is with us, our moderator, and now we want to do hands-on in order to show you the parts and enjoy it together, because I know this is a request from the colleagues, all right, in Morocco to see a hands-on. Let me switch the monitor to have it more clear for you so you can enjoy it in a better way. So I don't want also to go in details. I know from the participants that we have some beginners, and I know that we have some colleagues with a big experience. So the colleagues with a big experience, I'll try to give you some surgical hints that it help you, as I said in the beginning of the lecture, to modify your surgical techniques to make it easier, faster, better osseointegration, and better aesthetics and long-term success. So with any system, as you can see, I want to show you the kit, as you can see it here. Look for this beautiful color coding. And what I like with this kit, if you have limitation between the teeth, yes, you have this drill for the elongation, all right? I love in each system to have this pilot tapered, okay, with okay, this design, so you don't have a problem. You don't need to use round bear for the entry. So these special drills are perfect. You just go with the crest, as you can see here. I'll show you. This is the first entry drill or the pilot drill. You need only to use it for the cortical bone. And of course, if we are working in front of the mandible, I always recommend that you come with 3 o'clock position, so you don't go in the undercut or injure the sublingual, okay, artery, because this is very dangerous. So always you need to go, don't come in front of your patients, all right? Because in this way you might make perforation lingually and harm the lingual artery, which is very dangerous and life-threatening. So always be with your patients with a 3 o'clock position, and you start only drilling in the cortical bone and you stop. You need only the first entry. Even if you have multiple implants you want to do, is the same thing. I will finish all my implants. I want to place for here, for example, here 4 implants. So I only drill the cortical bone and there is no slipping, okay? Because why? This is pointed drill, and that is the beauty of it. You finish with this. Let's say you want to place 14mm implant. I will go, this is the 8, this is the 10, this is the 12, this is the 14mm drill. So if my implant is 14mm, okay, I will take, all right, the 2.2 drill. All right, that is the first drill after this pointed one. So I take the 14mm, and you can see here, even okay, if your nurse after sterilization she made any mistake, the numbers are written.
برا قول له احمد يطلع تو يدخل تو يا عماد.
Okay, they are there. So I use my 14mm drill, as you can see here. I go in this way and I just drill all the way down. All right, and I know that I have a stopper. All right, I know I have a stopper. Okay, I want to share with you also something. There was always a big research and debate. Shall we drill fast or shall we drill slow? Which is better for the bone, for the heat generation? Drilling slow or drilling fast? What do you think, colleagues? Somebody will say to me, well, drilling slow is less heat generation. Drilling fast is more heat generation. That's what we thought. That was the classical thinking. Now, the most important thing is the time, the duration you are inside the bone. The longer you are drilling, all right, the more heat will be generated and stored in the drill and goes into the bone. So up to 8 to 10 seconds maximum, you will not get the temperature reached from 37, which is the body temperature, up to 47. More than 47, bone necrosis will happen. So if you are drilling, all right, very slowly, and you are taking, for example, more than 10 seconds, then the heat is raising, and it will go to the necrosis part. But if you are drilling very fast and less than 10 seconds, you will never reach the 47, which is the necrosis time. So to summarize this point, a drill fast, good cooling in a short time is better than drilling slow and taking a long time. All right. So the speed I always use with the speed with 1200 RPM. Okay, you wanna use 1000 RPM is okay, but I am against using 400 RPM or 300 RPM, especially with a cortical bone, because you will not finish your osteotomy for a 14mm implants in 10 seconds. All right. But with a fast speed, you can finish in 2-3 seconds, so you don't overheat the bone. All right. So let's say I want to place 10mm in the other one. So I will just take the 10mm. I want to place 12mm. I use the drill of the 12mm. So every length has one drill. So I will use now 12mm, for example, for the other implants. That's it. I have a stop. I have a stopper in every drill. Now I will go to the 3.3 millimeter drill, as you can see here. For the 14, this implant, we decided 14, so I drill with this 14. That's it. Even if I'm not looking anywhere, the bore will stop. The second one is the same thing, 12 millimeter, I take the 12 millimeter drill. The same thing, I don't need even to look because I know the bear will stop. That's it. Now, if I am deciding for this case to use the 3.7, I just go for the 3.7 drill. If I want to use 4.3, I go for the 4.3. If I want to use 4.8, I will go to 4.8. But my advice to you, if you are drilling 4.8, please do not jump from the 3.3 to the 4.8. And especially if you have D1 bone, you will generate too much heat. So it's better to go in this sequence. So if you have a 3.7, you go to this drill. If you have 4.3, go to this one. But if the bone is D1, I would recommend go with the 3.7, then go for the 4.3. So now we are drilling in the anterior of the mandible. Definitely, we have D1 bone. So with D1 bone, I like to go with all the sequence. So you see that you are drilling very fast and everything is fine. The same thing for the second. Why I'm drilling for 2 implants? Because I repeat for the colleagues. So this is the 12 millimeter. I just drill for the 12 millimeter. That's it. The same thing for, let's say, the 4.3. So now the implants that I want to use, and we are planned for this case, this is the 4.8 12 millimeter. This we have here the 3.3 10 millimeter, and we have here an implants of 3.7 10 millimeter. All right, so as long we drilled for the 12 millimeter, and we have this implant for 12 millimeter, and we want to use 4.8. So what we will do, 4.8 12 millimeter, this is 8, 10, 12. So we drilled for the 12 millimeter for the 3.7. I will not jump to the 4.8 directly. I am drilling in D1 bone. So I will take now the drill of the 4.3, and also it will go smoothly. I am very fast. Look how many seconds it takes, maybe 2 seconds, 3 seconds, because I am putting on my motor 1000 RPM. I don't use a slow speed. All right. So I go now to the final drill of the 4.8, and always my stopper is there. So I am done with my osteotomy. All right. Of course, with your patients, you will not tear him up like this. So my implants, the drilling is completed. And now I want to open my implants. All right. Of course, my non-scrub assistant will open the implants for me. And this is the time. It's not my job. It's the assistant, the non-scrub nurse, to open this package. So the package is opened. And this is a tissue level implants. And these are the bone level implants. Of course, we drilled for the bone level. So we're gonna use the bone level implants. And anyway, it is the same drills, whether it is the bone level or the tissue level. So we will show you both now. And you can see both drivers. So you want to start with the bone level. Let's do the bone level. We have here the 3.3, and we have here the 3.7. And so we drilled for the 3.7 for the other implants. So now we will place the bone level. This is the beautiful packaging, as you can see here. But I want to show you also inside, so you can see the beauty inside. That is the implant, and this is the way still your assistant, the non-scrub assistant, who is using this, and now she opens the package for you, and also all the information is also on the package, so you are always controlling the diameters and the sizes. So we get the implants, and now this is the time of the surgeon, who is sterile and can hold this bottle. You open for the implants, you put this aside, as you can see here, and this is the cover. You remove it. I love to place my implants, okay, with the handpiece mounts. I like to place with the handpiece. So this is the mount that I put it, all right? And this is the way I hold my implants. So I bring, yes, the implants. Well, okay, this is the implants placement, 50. Exactly. Now, this is the way I just fix it and hold my implants. You can see. So you don't touch anything. And this is also the beauty. And this is a secret. Not many dentists know it. What is the surrounding and how is the implant is placed in the package? This is a peak, a very special, all right, material with the titanium. There will be no contamination for the surface, which is, you know, rough and sandy blasted and acid etched. So the peak is the best thing. And the implant is stable. It will not fall down. All right. The friction is really perfect, because I know some implant systems, you are holding the implant, then it falls from the, all right, from the mount. So you bring the implants, you go here, and because with a special design, because we said it is tapered, it is just there. You are placing the implants with 550 RPM, and the implant is there. Look, I'm holding it really hard. All right. I have the excellent primary stability. Look to the primary stability. We just prepared for the 3.7, and the implants has an excellent primary stability. So this is the time I continue, and this is the motor is stopped at 50 RPM. All right. If I can see that I need more with the implants to put it inside, I just need to put the handpiece, bring my special key manually, as you can see here, and I hold my ratchet, and this is my ratchet. All right, I can put and see how many RPMs I have, sorry, how many newtons, 15, 25, 35. Then I start with a finger rest here, and this I can measure. Look, my implants is more than 35, and I know to the motor it's 50 Newton centimeter. All right, this is an excellent primary stability. And then I can even use it without the torque control or with the torque control. This is a very strong ratchet. That is the beauty of it. So use it here or use it here. Don't worry about your ratchet because it is there. And this is the time that you have your implants in a place, as you can see it here, with excellent primary stability. Now you have only one prosthetic key. That all what you need for the healing cap. This is the key, as you can see it here. You can see it here. Yes, this is the key. And where is the healing cap? It is here. It is mounted on the peak, which is friendly to the titanium surface. So I just hold my key. I unscrew my healing abutment. Also, it will never fall because the accuracy of the manufacturing, everything is perfect there. So you bring it, and that's it. And you just turn it and fix it on the implants, and you are done. So these are the steps. They are very fast. Let me summarize again. You get the pointed, okay, or the marking drill, then the 2.3, 2.2, then the 3.3, 3.7. That's it. So each diameter has all the drills in one kit. 8, 10, 12, 14. 8, 10, 12, 14. 8, 10, 12, 14. Whether it is 3.3, 3.7, 4.3, 4.8. You need rotary mounting head, it is there. You need a short key or a long key. Both are available in the same kit. And if you are using tissue level, as I will show you now, the other tissue level is the same thing that it is available. So this is, all right, our second implant, that it is a tissue level. Same thing. I will open it also for you. Color coding for the diameter. This is the red. You open the implants. Same thing. Same protection. Same cover. Amazing packages. This is the implant. And now you want to use the rotary. The same thing. You need to look in your kit and you see here written tissue level. So you pick up the tissue level mounting drill. You go same thing to the kit. This is the tissue level implants. Look how beautiful it is. Your osteotomy is done, and you start placing your implants. And look also to the conical design. 2/3 of the implants is already inside the bone. So only you need just to complete the rest of it. This is the speed. The implant is going into place. The implant is going into place. And you continue till all of the rough surface is there. You continue and look to the primary stability. You will get 50 Newton centimeter. See, this is the beep for the 50 Newton centimeter. So you have now your implant, the tissue level, excellent primary stability. I want to control my stability also to see how much we have from the ratchet. Yes, it is there. Look, it is correct. We have more than 35 Newton centimeter. Excellent primary stability. And I showed you with the clinical cases, even the splitting of the bone, you will get 35 Newton centimeter. Why? Because of the special design. Now I need to pick up my healing abutment for the tissue level. Yes, it is there. And I can use and pick up my key, as you can see here, the same prosthetic key for all the parts. And this is the special healing abutment, as you can see it here. All right. And as I said, everything is fixed, nothing will fall down. And you go fix it, as you can see, and you make an open healing. You suture, and this will remain like this is your gingival former. All right. So that is the option, whether you want to use bone level or you want to use tissue level. Both are available with all diameters, with all lengths. Of course, in the kit itself, you will see other parts. For example, okay, I'll put this back in place. You can have barreling posts. If you are drilling for one implants, yes, they are giving you barreling posts. If you are not sure about the depth and you want to control it after the drilling, but every time it is perfect. But some dentists, they love to control the depth after they drill. Yes, you have a depth gauge. But to be honest, I don't use it because I know the drill is 12 millimeter and it does not drill more than 12 millimeter. So why do I need to control? Everything is clear, but if you need it, you have it. If you want to place the healing abutment with the rotary, with the handpiece, yes, they give you the 1.2 hex also with the rotary. And as I said, only the conical connection for the 3.3 is different. That's why you have these also available. So all the implants, 3.7, 4.3, 4.8, 5.5, you only use one mounting drills. Except the 3.3, because it is very narrow, they make a smaller, because there is no room to make a bigger conical internal hexagon. So they have a special mounting for them. That's it. So the kit is simple. That's all about it. You have the ratchet, a beautiful ratchet that it can last for many, many years. It will not break. I have my ratchets from Implantswiss now for over 6-7 years. Same ratchet, never broke. So it is perfect. So we finished the main hands-on. I just want to share with you and show you, all right, the short implant surgical kit, because I told you in that kit, if you remember, we having from 8 millimeter, but also with Implantswiss, we have 4 millimeter, 5 millimeter, and 6 millimeter. So we made a special kit only for the short length implants, for the short implants. And this kit, as you can see it here, with the tissue level, you have drills 4 millimeter, 5 millimeter, and 6 millimeter, whether for 4.3 or 4.8 or 5.5. For the bone level, we are starting from 5 millimeter. So you have drills for the 5 millimeter, and from 4.3, 4.8, 5.5. And the drills come from 2.8 to 3.7, and then according to diameter. The same thing, you have the same mounting drill for the implants, where you can hold it the same 1.2 hex and whether you use it with the ratchet or manually and the point drill. So it's the same thing. You have the short implant kit. If you are not a friend of short implants and you are starting with Implantswiss, I think this main kit is a good solution for you. If you wanna use short implants, then you need the short implant kit. The last kit I want to show you today is the prosthetic kit. The prosthetic kit mainly is the same thing. You have the 1.2 screwdriver, the short, and the long ones, and the extra short and the extra long. So you have it all. If you have solid abutments, okay, you have a driver for it. If you have the locator for the overdenture, yes, we have it. If you have the octa abutments, yes, you have for it the short, the driver, the short and the long. The O-ring abutments, yes, you have it also here. All right, for the overdenture, and then you have the two-pair ratcheted driver is here, same ratchet that you are using it. So also this prosthetics itself is available, especially if you are using the bar matrix or the locator, you have all the tips in it. All right, but if you are, let's say, using the classical cases, you actually don't need this. The basic kit here with the screwdriver, that's all what you need. But of course, if you want over-ring or you need locator or you need to work with different prosthetic, then you can get this kit complete or you can buy individual pieces. So this is all available. These are the abutments I just want to show you. So you have a feeling also for the cases. We have a beautiful packaging for everything. You can see here, I'm opening just one box. Every abutment is individually, all right, wrapped and very nice package. The fixation screw and the abutment, it is there, as you can see it here. And of course, all the information you need to be, it is in the back. So this is what it says. This is 4.5. This is 25-degree in angulation, and the tissue height is 2 millimeter. So you have 2 millimeter, all right? You have the angulation and you have the diameter, and these are for the bone level. So we open it here. I want to show it to you again, but if you want to use this abutment, yes, you can use it for any implant, for the 3.7, for the 4.3, for the 4.8 or the 5.5, because this hexagon and conical connection will fit for all the implants together. I think I covered everything. We apologize if we took too much from your time. We agreed on 1 hour, but now we are only 5 or 10 minutes more. So I want to thank you very much for being with me. I hope with this limited time, I was able to cover the classical catalog drills step by step. I shared with you some cases and we did hands-on together. And I'm sure in Morocco, you can contact your dealer. You can play with the material, you can hold it yourself, you can do hands-on yourself, and you can use it on your patients. And now I open the podium for all our participants for any questions you have for me. And thank you for being with me. So the podium is yours now. Ibtisam, you can open the microphone for the colleagues who would like to have questions. And I'm ready here to answer all your questions. He is asking, is it same abutments even for 3.3 or different ones? Thank you for this smart question. It seems you are following very well. And I mentioned this, all the same abutment for all the diameters except the 3.3. The 3.7, the 4.3, the 4.8, the 5.5, it is one abutment, one conical connection, one size. The 3.3, because it is a very thin implant, and in order to have an implant strong and never break, they made the conical connection smaller. So only the 3.3 has different tools, different abutment, different transfer, different implant analog. And that's it, only one diameter. But I don't think you will use too much 3.3. Do bone splitting and use 3.7. Immediate loading. This is from our colleague. Immediate loading, yes. If you have a primary stability more than 35 Newton centimeter, you have a good length, and good diameter. If it's an anterior zone, single implant is okay, so you can do immediate loading. But in the posterior mandible, on the posterior maxilla, this is a red zone. Don't do immediate loading, even if you have a 35 Newton centimeter primary stability, or even if you have long implants or big diameter. The risk is high because we only have a primary stability. We are waiting for the secondary stability, the osseointegration, which will need from 3 to 6 months. But if you have more than one implant and with good primary stability, more than 35 Newton centimeter, yes, you can make immediate loading. Of course, completely edentulous for immediate loading, splinted together. Yes, it is brilliant. So generally, immediate loading, I cannot say a general rule, yes or no. It's a green, it is yellow, it is red. Red, never do immediate loading. Single posterior, I will never do it. Green, single anterior with 35 Newton centimeter, good quality of bone, D1 or D2, good length of the implant. Yes, go ahead, do immediate loading, but of course, with temporary crown out of occlusion, not functional, all right? Aesthetically, it is there. Yes, no problem. All in 4, all in 6, completely edentulous. Yes, it is green. Do immediate loading. Central incisor, okay, or canine, I still say yellow. It depends on the length of the implant, the diameter, and the quality of the bone. So there is no black and white. There is a big range of gray zone, and you need to be careful with immediate loading. Another question, what about PRF? Yes, PRF is good for soft tissue healing, not for bone, all right? PRF is amazing. You can get faster healing, good tissues. It can improve, all right, the outcome in such cases of sinus lifting, but not for every case, because the armamentarium is not really easy and you take part of things. So PRF, yes, I use it for some cases with sinus lifting augmentation, but there is no proof so far about the improvement of bone equality. For soft tissues, yes. For faster osseointegration, it does not, but only for soft tissue healing, yes, there is no doubt about it. Thank you very much for joining us, and I am always available. You can contact Implantswiss for my contact details, or easily you can find me drtamimi.com. It's easy. Just type Dr. Tamimi, no space, no dot, nothing. You will find me. I'm available with all social media. You can follow me up. If you have any questions, any consultations, any x-rays to share, please feel free to contact me anytime. I'm available always 24/7. Have a wonderful evening.